A lot of times in medicine, what happens is a intervention that we have used for a while or something that we've thought has worked for a long time just turns out that it doesn't. And for a long time, we weren't really sure about pelvic binders, and there's some new data that might actually help change our minds. So I'm going to go ahead and show this study here. This came out of Germany. So this study is out of Germany from the Injury Journal. It came out in January of this year, and it asked the question, does a pre-hospital applied pelvic binder improve patient survival, right? So the idea that they kind of thought about with this study and what they've thought about with pelvic binders for a long time is if we have a pelvic injury, right, the pelvis is kind of shaped like a bowl, so it just kind of holds blood there. If we decide that we're going to try and stop that bleeding, perhaps with binding the pelvis because the pelvis is kind of fractured like an open book, if we can stop that bleeding, maybe we can improve outcomes. And this study is pretty well done. And it's available online. I'm going to link it down below in the show notes as well. But one of the important things I think that we have to talk about here is the conclusion. The conclusion says our study finds that pre-hospital pelvic binders did not significantly impact patient outcomes for unstable pelvic fractures, with injury severity score being the strongest predictor of survival. It says assessing injury severity and managing blood loss remain crucial for these patients, and while pelvic binders may not impact survival significantly, they may still play a role in stabilizing pelvic fractures and managing blood loss. Now, a lot of people are going to read that and say that, well, that means that pelvic binders don't work, and that's not exactly the case. So what we see with this study is that pelvic binders might not improve survivability right now as per this data set. And often you hear, you've read one study, you've read one study. So I think this study shows that in this particular set, we haven't shown improved survivability. But in trauma, we want to stop blood loss and we want to try and reduce injury, right? I think that pelvic binders might actually have a place right now in the trauma treatment, which is to stop bleeding. But it's hard to know, right? If we have one study that shows this and we have some that show that, well, if stopping bleeding fixes traumatic injuries and it improves survivability, it would stand to reason that using something like a pelvic binder would improve survivability. The data is just not there yet. I do think we'll get there in the not too distant future. We're just not quite there yet.